I wish to apprise the national community of the latest developments relating to influenza A H1N1. Yesterday evening, the ministry issued a statement informing the public that we were investigating 2 deaths from serious respiratory illness at the San Fernando General Hospital. The deceased are adults, and they all presented acute respiratory symptoms during their hospitalization. This morning, we received the results of the confirmatory tests for H1N1 for these individuals, and they were positive. Therefore, we are confirming our first 2 deaths for H1N1. Unfortunately, today we are reporting those deaths related in Trinidad and Tobago. It is indeed difficult and sad for any Minister of Health to report fatalities to the nation. And although on the scientific level we expected this, on the human level, it remains disheartening and frustrating to lose lives to this new virus. From early on, we have been communicating the seriousness of the pandemic to the nation. You would recall that in many instances, I have said that as much as we were thankful that Trinidad and Tobago had reported no deaths until today, no country was immune to fatalities. This is something I also repeated recently, both in the post-cabinet conference of September 17th and in my contributions in Parliament during the debate last month. In fact, in Cascadia earlier this week, I repeated it again. I know that a lot of citizens have followed our advice, and I want to believe that no one has become complacent amidst this serious public health threat. Currently, almost every country in the world is reporting H1-related deaths. As of October 9th, PAHO reports a total of 153,697 confirmed cases in all 35 countries in the Americas region. A total of 3,406 deaths have been reported among the confirmed cases in 25 countries of the region. To date, in Trinidad and Tobago, there have been reported 158 laboratory confirmed cases of influenza A H1N1 and 2 confirmed deaths. The threat was and remains a very serious one. We are currently facing a serious situation that we continue to manage. Apart from the 2 H1N1 fatalities that have been confirmed, another death is currently being investigated. Firstly, I wish to extend our most sincere condolences to the families of the deceased. Secondly, I wish to inform the public that all due protocols has been followed in the clinical management of these patients. I am going to ask Dr. Prasad to speak to that very shortly. And additionally, we are in the process of auditing all protocols surrounding these deaths. Our preliminary report findings suggest that these individuals came into the hospital quite ill, in respiratory distress, one of them quite late in the course of his illness, while the other came from another private institution. It also appears that there were other underlying risk factors. The investigations are ongoing, and a team of ministry officials are working alongside the healthcare professionals at the Southwest Regional Health Authority to ensure we fully and accurately assess the situation and respond appropriately. At this point, we wish to once again urge the public to take all necessary precautionary measures to minimize the risk of contracting the H1N1 virus. Persons attending mass gatherings such as church services, sporting and social events, school and daycare centers, as well as the high-risk categories, are particularly alerted to to follow all recommended guidelines. High-risk categories include pregnant women, children under 5 years of age, persons with chronic medical conditions, including asthma and other lung conditions, sickle cell anemia, heart disease, diabetes, HIV/AIDS, and any other condition affecting the immune system. The Ministry of Health appeals once again to all citizens to adhere to the following guidelines. Wash your hands often with soap and water or with an alcohol-based hand sanitizer. Cough or sneeze into a tissue or your elbow instead of into your hands, and properly dispose the tissue. Avoid contact with people who have respiratory illnesses. If you have a flu-like illness, stay home from work or school and limit contact with others to avoid infecting them. Delay your travel. All parents, teachers, and students are urged to follow the established protocols from the Ministry of Health and the Ministry of Education, which is available at www.health.gov.tt. What is also important is for people with flu-like symptoms to immediately seek medical assistance if they show any of the following emergency warning signs. In children, fast breathing or trouble breathing, not drinking enough fluids, being so irritable that the child doesn't want to be held, flu-like symptoms improve but then return with fever and worse cough, fever with a rash. In adults, difficulty breathing or shortness of breath, pain or pressure in the chest or abdomen, sudden dizziness, confusion, severe or persistent vomiting. All citizens are asked further to seek official information on the influenza A H1N1 through the ministry's website, as I said, at www.health.gov.tt, or Facebook group Ministry of Health, Twitter at MOH_TT, email us at corpcom, CORPCOMM @health.gov.tt. Ladies and gentlemen, I thank you very much.